ma'am. How are you today?
I'm good.
Are you comfortable? Is the lighting good?
Yes.
So great. Let me introduce myself. I am Danica Lupasanting and I am a student nurse from today. But first, let me grab this alcohol to prevent the microorganism. So you can have this too, ma'am.
Thank you.
So can you please state your name, ma'am?
Okay, my name is Janaiza Feliz Timosa Panisa.
So how would you like me to call you, ma'am?
Just call me Nice.
So, Ma'am Nice, just for verification, may I ask when is your birthday?
September 1, 2003.
Uh, and how old are you, ma'am?
I'm 19.
Okay. So, ma'am, basically I will assess your hair, skin, and nails, and for me to able to assess those parts, I'd like to ask for consent to touch certain parts of your body. Is it okay with you, ma'am?
Yes.
Okay. Rest assured that this all information will be confidential between me and the attending physician that I will be referring to. So before we start the assessment, I will be asking you some question about the current condition of the skin. So ma'am, there is any clarification, question, ma'am?
None so far.
Okay. So now ma'am, I will be getting your history taking. So alright, have you noticed any redness of your skin?
Actually, yes.
Okay. So you have rashes?
Yes, I think
It itchy or sting?
it's itchy.
Okay. Can you show me, ma'am, where it's located?
Here and
Okay. So both of your arms contains the rashes, right?
yes.
Okay. So what do you think triggered the rashes, ma'am?
I think because I use soap last night and the rashes just pop up. Yeah.
Okay. So you were using this soap and rashes pop up all over your hands. Okay. So now, ma'am. So how intense is the itchiness? Can you rate it from 0 to 10 or 10 is being the worst itch?
I think 3 to 4.
3 to 4. Uh, do you take any over-counter medication or ointments for the skin rashes?
For medication, it's just cetirizine.
Mm. So how about unusual darkening, lightening on your skin, ma'am?
Nothing.
Okay. So do you have any tattoos, ma'am?
Mm, None.
Okay. So you have any changed condition appearance of your nails, ma'am?
No.
Okay. How about hair loss, ma'am?
Yes.
Okay. Uh, the next question, ma'am, is all about the past health history. So the information give the nurses and doctors all kinds of importance clues about what's going on with your health because many disease in families. Is it okay with you, ma'am?
Yes.
Okay. So do you have any problem previous with your skin, hair, nails?
Yes.
Okay. How about allergic reactions, ma'am? You have allergic on food, drinks?
Actually, yes. When I eat some shrimps
Mm.
and eggs in medication, none so far.
Okay. So, did anyone from your family experience or skin problem, ma'am, or cancer in skin?
No one.
Okay. For your current lifestyle, ma'am, how long do you usually expose yourself in the sun, ma'am?
Actually, 30 to 1 hour a
Okay.
day.
Mhm. So, how about exposure to chemicals, ma'am? Do you use any lotion or skin products?
Yes.
Okay, yes. Is it for moisturizing, ma'am, or whitening?
It's moisturizing and whitening.
Okay. Do you have any routine for your skin, ma'am?
It's just I take a bath every day.
Okay, okay. So, what do you usually eat in a daily basis, ma'am? On breakfast, lunch, dinner, or snacks?
In breakfast, I just drink coffee and bread. My lunch, I eat heavy lunch,
Mm.
and my dinner, I'm eating heavy dinner too.
Okay. So, is this anything at home that stresses you, ma'am?
Not so far.
Okay. So, do you usually manage your stress, ma'am, if there is any?
Yes, I can.
Okay. Right, ma'am, that is for history taking. So, I asked you earlier to touch certain parts of the body for this assessment, ma'am. So, now I'll perform hand hygiene to prevent the spread of microorganism. And also, I will wear gloves. So that now, ma'am, that I am done wearing my gloves, ma'am. Can I check your arms po, ma'am?
Sure.
So generally, ma'am, I can see that your skin color is consistent and I don't see any hyperpigmentation or any discoloration of your skin. Also, I not notice any usual odor emanating from you. So, ma'am, this time, ma'am, may I see your scalp, ma'am?
Sure.
Okay, for any scars and lesion. So basically, ma'am, I am just palpating and inspecting her hair for any scars on lesions that is present. So what I wanted to look for is for the distribution of the hair, thickness, moistures, textures, and lice and dandruffs. Okay, ma'am, I'm done with your hair assessment, ma'am. I'll remove my gloves now, ma'am, and properly dispose it to the waste basket. And the most important, ma'am, is to perform my hand hygiene again. So, ma'am, I didn't see any scar of your scalp, ma'am. And there's also no lice and dandruff. The moisture and the texture is good, and I see that your hair is evenly distributed on your hairline, eyebrows, and lashes. So, ma'am, nice. I can see that you've taken good care of your hair. So, and now, moving on for the assessment. First, I will check for your skin color. So now, ma'am, I need a pen light. Wait a minute, ma'am. So now, ma'am, I can see that you have even pigmentation on your skin and you don't have any darker or lighter areas. Also, ma'am, there are no yellow skin, of course. Yellow skin colors for jaundice that could indicate liver, gallbladder, and pancreas problem. However, ma'am, I see that you have reddened areas on the skin and your left and right forearms due to the rashes that you complained earlier. So, this time, ma'am, I will be palpating the skin of my patient. I will be using my dorsal of my hand because some nurses believe that it is moved to accurately measure temperature, moisture, and texture. So, ma'am, may I touch your cheeks, ma'am, and part of your head? Okay. So, the moisture is good and the skin is warm to touch. Texture is smooth and the skin is not too dry and not too oily. So, ma'am, may I have your forearms? So the skin moisture is good and not too oily and too dry, and the temperature is normal. Okay, thank you, ma'am. So normal temperature is usually at around 36 degrees Celsius. So inflammation and the tissues of the skin can cause changes in temperature, which is why we need to assess the temperature of the skin. And also, I have to take note of dry of the skin of areas of yours which could indicate the hydration excessive of use of soap. So this time, ma'am, I will be checking the texture of your skin. So skin texture for arms and forearms is, I will check if it is smooth. May I have your hands, ma'am? So, uh, your skin textures of your arms, ma'am, is smooth. Your palm, ma'am. Okay, smooth. Your palm, ma'am. But your palm, ma'am, is rough because this is usually of callus that is exposed to constant pressure. But that is normal, ma'am. So, ma'am, this time I will check for your skin mobility. So, I will slightly pinch the dorsal surface of your hand. So, may I have your hand, ma'am? So, 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 So I can see, ma'am, that your skin finishes easily, which is indication that you have normal skin mobility, ma'am. And also, the hair is elastic since it went back to its place right away. So this is indication that you are well hydrated. So earlier, ma'am, I inspected for rashes on both of your forearms. So this time, ma'am, I will wear gloves to apply the pressure to those area and assess for blanching. But before that, the thing is, I do my hand hygiene and also I wear gloves to prevent the microorganism. Also, ma'am, this time, ma'am, I will assess for the rashes that we looked earlier, ma'am. So, may I have your forearm, ma'am? Okay. Uh, in my fingers, ma'am, I will apply pressure on the area, ma'am, with rashes and check for blanching. Then, okay. So, usually, ma'am, for the rashes, we apply pressure on the area to assess for blanching because blood leaves area with pressure and we are wearing gloves to avoid high risk of infection. So, not now. Now I am done. I will dispose my gloves and perform hand hygiene to prevent also the microorganism. Are you still good, ma'am?
Yes.
Okay. So this time, ma'am, I will check for my patient nails. Can I see your nails, ma'am? Okay. So I can see that they are clean and well manicured. This pink tone, and I also it is firmly attached to the nail bed and not moving at all. So this time, ma'am, I will check the shape of your nails. So can you do this for me, ma'am, to form a diamond?
Okay.
And can you lift up, ma'am? Okay, good. Okay. So all right, ma'am, for the shape of your nails, I can see that is less than 180 degrees ang angle between your nail bed, skin, and there are no clumping. So this time, ma'am, I'll check for the capillary fill on your nails. Can I see, ma'am? Uh, so the capillary fill, ma'am, is less than 2 seconds. So it is usually indicated by this immediate return of the pink tone of your nails. And it is normal within the last 2 seconds. So, okay, ma'am, for the last part, I will palpating for edema. But before that, I need to wear my gloves and also perform hand hygiene. This time, ma'am, I will use my thumb to apply pressure on your feet, ma'am. So, what you want to see for a normal finding here is the skin should rebound and there should be no indentation of your feet, ma'am. Okay, ma'am. So, can I have your feet, ma'am?
Sure.
Okay. Okay, the other one, ma'am. Okay. All right, ma'am. There is no indentations are found. So, therefore, there is no signs of edema. Okay, after I touch your patient's foot, ma'am, or your foot, I will draw my gloves, ma'am, and also I will perform hand hygiene again. Okay. So now, ma'am, now that we are done with assessment, I will sum up everything that I noted. Wait a minute, ma'am. Okay, ma'am. Your skin is consistent with even pigmentation, the lighter or the darker areas. No yellow pigmentation on the skin, red and itchy areas is found on both forearms. Okay, your skin moisture also is normal. So skin is warm to touch, skin texture is smooth in most areas and only feels rough on palms, okay? The skin can be pinched easily and return to its position, indicating normal mobility. No indentation of the feet and no signs of edema. Nails are clean, color and shape of nails are normal, nail texture is had to remove build smooth and firm. So now, ma'am, and the capillary also is refilled in the last 2 seconds. So, ma'am, ma'am, nice for your nails and hair in great condition. You just have to keep yourself hydrated and drink a lot of water, at least 2 liters per day. Okay, ma'am. For your health concern, you have impaired skin integrity related to irritates or allergies. But for this time, ma'am, just avoid using the soap now and perform hand hygiene all the times, okay?
Okay.
Okay. Okay, that's it. I have the results. So the assessment, I'll just head out to give it to attending physician. So, ma'am, do you have any concerns, clarifications, or questions?
None so far.
Okay. Thank you so much, ma'am, for your cooperation. We'll just call you for the follow-up interview or anything test, ma'am. Thank you so much, ma'am. Have a great
Thank
day ahead.
you.